So good morning, everyone. Thank you, Anne, for a very generous introduction. Actually, I'd really like to thank Novartis Foundation for, number one, inviting me here. I've already learned so much from the speakers, and I look forward to learning from everyone here during the discussions. And also thank you for giving us the opportunity to share what has been accomplished in the Philippines. So this is actually part of the presentation. I am Teresa Dioko, and I'm part of the Novartis Pharma business. So I'm with the Novartis Healthcare Philippines. So I'm proud to be a Novartis associate, primarily because we have a strong platform in terms of corporate responsibility. And we recognize the need to collaborate with others. Number one, to improve healthcare access, and number two, to actually do business responsibly. In the Philippines, our primary key advocacies are increasing healthcare access and research and development. So maybe the question would be, what is this Novartis Pharma person doing in the corporate responsibility projects? You know, down on the ground, closer to where the patients are, it is actually that when we work together with the Novartis Foundation, we identify objectives and results that are of common interest. You know, it's really common to actually say that, you know, when you do corporate responsibility, you increase reputation for the company. But what's maybe key or critical or important is that during and when we do these activities for the foundation, we do find sustainable and efficient healthcare access solutions. So they're good, they're practical, they're good for the foundation in terms of, you know, replicating possibly, but they're also good for the pharma organization because it's number one, it can potentially help us reach out to more patients, and also because it does provide, when you create a sustainable and efficient solution, it does make better use of resources, and we do get to have, you know, maximized resources within a limited resource setting in the health systems that we do work in. To achieve also, you may see it in the purple slide, to achieve also these objectives when we work with Novartis Foundation projects, we try to engage maybe a greater number of more than the usual stakeholders that we do engage with. So we've engaged with leprosy advocates, which are primarily the previous leprosy patients, and then we link up with Philippine Dermatological Society, Tropical Disease Foundation. We have more encounters with the WHO and the Department of Health and local government. So when we do these encounters, even within that local setting, we actually identify among us who are in the Philippines, more shared objectives. And so we grow in terms of relationship. We don't limit ourselves to our traditional roles. So Novartis is not just about selling medicines. The Department of Health can fund innovations and will fund innovations. And local governments, even in that smaller setting, are actually sources of some of the emergent strategies that we have found that have propelled our projects forward. So I think it's really beneficial. And then for our associates, while we do, it is not just me, obviously, who works with the foundation projects. There are many of us, going all the way from, of course, compliance and sourcing and the field force. And finance, when we are more exposed to these particular initiatives, we realize that, you know, we are part of actually a noble institution, and we become proud. And it just inspires people to do more. And people have actually come up to us and say, didn't know we were doing this, and say, yes, we are. Great. So As you know, Novartis is committed to providing multi-drug therapy for leprosy patients worldwide until 2020. In the Philippines, the Novartis Foundation supports this particular initiative. It's called Leprosy Alert Response Network and Surveillance System. Why is it important? Number one, while the Philippines leprosy prevalence is below public health levels, we continually report around 2,000 new leprosy cases every year. And these include children, which means there is active infection going on, and there are a lot of multibacillary cases, which means there's a possible delay in diagnosis. And in this particular time, when you do see leprosy cases, at least in places like the Philippines, it means that those people exist in areas that are just slightly outside the mainstream healthcare system. So when we do reach out to these leprosy patients, it means that we are also trying to, we are also doing some kind of inclusive development, and helping in that manner. So this figure actually illustrates to us the different stakeholders and the roles. So we have the Department of Health, who does now fund part of the program, local government. We have the Department of Science and Technology, there as PCHRD, the development, so they helped fund also the development of the mobile health system that I'll be talking to you more about. They do technical support. We have leprosy experts who volunteer their time. And we have MetaHelix, the IT developer. And we have Novartis, aside from provision of drugs through WHO until 2020. I've just learned from Krishna that we also address the critical gap of knowledge and networking by providing platforms for engagement. Cool. See, so I learned something today. Yeah, so what is the LEARNS system? The LEARNS system is a combination of local government leaders and health workers coming together to identify their own local response to leprosy. So when a leprosy patient comes, when you're doing the LEARNS program, then you also have to identify who's going to be doing the management. Sometimes, it's not automatic within areas where the leprosy expertise is not always there. The LEARN system also includes training for case finding, mobile health system for consulting with leprosy experts, and generation of reports. So the most commonly featured aspect of LEARNS is actually the mobile health consulting feature. So through these systems, midwives, or barangay or village health workers can send symptoms, other health details, and a picture of a suspect lesion via SMS or MMS using a single number. The system sends this to the leprosy expert identified for the area, who answers back by mobile phone or using a computer, a likely yes, likely no, or maybe, and final diagnosis is left to the municipal doctor. So the system also sends an alert, so it answers the frontline health worker, as well as sends an alert to the municipal doctor regarding the referral, so that the MDs expect that the patient is coming. Preset messages, such as patient to come in by 7 days, is sent to help propel the patient to consult, or have the barangay health worker remind the patient that he or she does need to go consult. So by providing this type of connection, the gap in the number of existing leprosy experts is addressed by, getting them closer, helping the people, frontline health workers, identify exactly where they are and making this connection. And it also helps decrease delays in diagnosis. One of the flexibilities of the system is that it can follow the preferred referral system of local government. And obviously, it helps address challenges of availability of transportation across mountains or islands, and of course the problems of cost for the transportation. We like to use the term sexy. So mobile health does have that sexiness factor. It generates interest so that there's interest among the frontline health workers. But after a little while, it does wane a bit. So the system also provides outgoing messages or reminds frontline health workers to watch out for leprosy cases. And in certain times, patients may opt in. Patients or their next of kin can receive reminder messages. So currently, we are on the way to document impact in terms of LEARNS through an evaluation study. But what has been achieved so far? Number one, Novartis, through the project, has continuously engaged with government and other stakeholders to strengthen the agenda of leprosy patients. Number two, we have worked in consultation and collaboratively with leprosy patient groups and advocates, the Department of Health, the specialty societies, the Philippine Leprosy Mission, to discuss solutions with efficiency and sustainability as primary considerations. So, to conceptualize possible good solutions, Novartis and the Department of Health also ran a national contest for innovative ideas and best practices, also helping increase the awareness for leprosy and facts about leprosy. A national contest that actually also emphasized how easily leprosy is curable and how treatment is free. So here we have Novartis Field Force, who are more aware of the corporate responsibility and do discuss this with some of their contacts. For this year, they were equipped with a digital detail aid to discuss cardinal signs of leprosy with physicians. So they talk with who may inadvertently see leprosy cases. So one of the suggestions was actually from a neurologist who said, we see people with nerve damage, and so it's good to remind us about also considerations regarding leprosy. There, more importantly, we have commitment from partners. Number one, the Department of Science and Technology has contributed to the development of a leprosy-related tool, and they continue to do so by volunteering to provide for the SMS, the cost of SMS messages or MMS messages. The LEARN system has been rolled out in 18 local municipalities in the Philippines, supported primarily by the national and the local government budget. The Department of Health has supported the training of trainers for LEARNS. And by the end of the year, national and local government support will have LEARNS rolling out to another 9 cities and possibly another 24 municipalities. So also, over the first few months, LEARNS has identified patients coming from geographically isolated and disadvantaged areas. So this is how the public-private partnership has grown. We've gone through periodic consultations, starting with the first Leprosy Symposium in 2012, and it continues. We run ideas and consultative workshops. We have collaborating efforts. Here we actually ran together with the Department of Health and other partners, how does LEARNS fit in with other strategies and vice versa. And led by the DOH, we ask ourselves, are we doing enough to cover National Leprosy Control Program objectives? I don't know if they do it regularly, but WHO also gives us inputs in terms of, how will this particular system fit in eventually with a future LEARNS information system. So there's collaboration and coordination of activities. And of course, we hope that eventually an evaluation will prove that it's cost-effective and does benefit. And many people have joined us in this journey. Primarily, I would like to thank Anne and the team. We have Aya, Kiara, Edith, who are helping us. And with the Palawan project, or rather the Medicines Access project, we have Christina. And the many different associates from the country also, whom I've named earlier, finance, our CPO head, Nikos, who is also here, and my corporate affairs director, Chris. And so they've continued to give their time. We didn't know we were friends, but now we know that we're called friends of the Novartis Foundation. And so I thank and appreciate their efforts today, and I hope that the Novartis Foundation and the CPO CPOs, not just the Philippines, will continue collaborating for positive impact, not just for patients, but also now we know for associates. So thank you very much and good morning.